everyone, my name is Whitney and I'm a registered dental hygienist here to talk about and show you ways to check yourself for oral cancer at home. So I'm always hesitant to even talk about oral cancer too much because I don't want to freak people out. Most things that look funny in your mouth are benign. They are not harmful. So the goal of this video is awareness, not panic. Having said that, before we get into checking your mouth, I'm going to show you in my own mouth what to look for. Let's first talk about what to not look for. Because like I said, there's lots of random variants and weird looking things that are present in many people's mouths that are 100% normal. Anatomical variants, including canker sores, cold sores, mandibular tori, palatal torus, fissured tongue, geographic tongue, hairy tongue. And I also have videos on lots of these topics, which I'll link them all below if you want to learn more about, say, cold sores or a geographic tongue, what have you. I will link all my supplemental videos below as well. There are also things like amalgam tattoos, linea alba, cheek bites, different frenum attachments, Fordyce granules or Fordyce granules, and so many more, but those were just some of the most common ones within normal limits, as we say in healthcare. But now, as we move on to checking our mouths at home, one more time I want to remind you to think of this as awareness, not anxiety. You're not diagnosing yourself, you're just paying attention. If something you find lasts longer than 2 weeks, that's when a dental professional should look at it, so be aware, not alarmed. And here is how to do an oral cancer screening at home in between your oral cancer screenings at your dental office. I usually do this myself once a month. I'm wearing gloves here for the video, but you could simply just wash your hands before you put them in your mouth. First, you're going to look in your mouth, and it's very dark in there, even if you're in a bright room. So I recommend you use the flashlight on your phone or even an actual flashlight, whatever is easiest for you. What you're checking for is any suspicious lumps or bumps, especially around your tongue and the floor of your mouth. And to do this, I'm going to show you 6 steps inspired by the 6-step screening process, which is from Eva Greatcell's technique. I'll link her website below. Step 1, extend your tongue out as far as it can go, looking at the sides of your tongue and the underside for white and red patches, and feel your tongue for any lumps. The 2 most common spots that oral cancer is found are these spots. 1, the sides of your tongue, the lateral borders, and 2, the floor of your mouth, underneath below your tongue. So make sure you really give this first step some extra care. Next, step 2, the lip and cheek roll. Feel for lumps or bumps, looking for white or red areas that should not be there. Pull your lips up and down, really checking all areas inside your lips and cheeks. Step 3, double digit probe. Examine the floor of your mouth from the top and bottom simultaneously for lumps, while looking for white and or red patches. This is a supplemental way to check the floor of your mouth like we did in step 1. Next, step 4 is the palate tickle. Check the roof of your mouth for lumps and areas of softness on the hard palate, looking for white and red patches. Now, if you have a palatal torus, it might make it hard to see, so really use your flashlight in this area. Step 5, neck caress. You're going to want to palpate your neck for enlarged lymph nodes, which could be a possible sign of infection, as simple as you're getting over a cold or you're about to catch a cold, or it could be something more serious. Step 6, tonsils. Say ah and try to examine your tonsils for symmetry. Check for any redness or unusual lumps around the back of your throat. Now, if you did notice something that is clearly new anywhere in your mouth, something you've never seen back there before, again, don't panic. Maybe you're sick. Think about whether you might have a cold or something like that. But of course, if you're concerned, always call your dental office or an ENT, ear, nose, throat doctor for a quick exam. They can give you a peace of mind. Oftentimes they will tell you to give it 2 weeks, and if it doesn't go away in 2 weeks, then come back. You might need a biopsy. But usually, if you find something funny, it's going to be a cut on your cheek or on your gums from sharp foods like chips or crackers, or another popular one, you might notice a burn on the roof of your mouth. That can be from pizza. Pizza burns are a big one. Hot coffee, hot chocolate burning your palate. And please know, I am not trying to dismiss oral cancer when I tell you all of this. I'm just trying to lessen your anxiety because I know how it feels to be stressed out as the patient. But as the clinician, it's important for me to share that we see these things all the time in the mouth, the burns, the cuts, the variations in anatomy, and patients tend to be very nervous about them, rightfully so. You didn't realize you burnt your mouth or cut your tongue. So although it's difficult to balance, I'm really trying to acknowledge the seriousness of oral cancer without triggering panic. I don't want want anyone spiraling over a spot they saw in their mouth. Be cautious, yes, but also remember that most things in the mouth are harmless. What matters is whether something sticks around or changes. And lastly, before we go, let's go over a few signs and symptoms other than looking in your mouth that can relate to oral cancer, starting with persistent mouth sores or irritations that don't go away, red or white patches, pain along with these patches, tenderness or numbness in your mouth, your lips, or even your ears, non-tender lumps, thickening rough spots, crust or eroded areas, chronic hoarseness, abnormal swallowing, difficulty chewing, difficulty speaking, difficulty moving your tongue or your jaw, a peculiar sore throat, a change in the way your teeth bite together when you bite down. And having said all that, make sure you're getting your professional oral cancer screenings at your routine dental appointments. Self-checks at home are so important because maybe you will find something between your 6-month cleanings. But remember that the self-checks don't replace professional checks. Now, some dentists and hygienists I've noticed being in this field might not tell you they are checking for oral cancer just because of the huge anxiety situation, not wanting you to freak out. So they might only tell you if they find something wrong. But I think it's worth asking if you're not sure if they check. Because if you ask and they hesitate and they're like, oh no, sometimes, yeah, kind of wishy-washy, then I recommend you make sure you ask for an oral cancer check at every single dental appointment or find a different office. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And I'll link a bunch of those supplemental videos below, as well as my free oral care guide, which goes over ways to keep your mouth healthy regarding reducing your risks of not only oral cancer, but also gingivitis, gum disease, cavities, all the things are in my free oral care guide. And until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.